I'm not going to spend as much time on this in terms of treatment guidelines, because treatment guidelines are not well established, but I want to talk about some very critical issues, and in particular talk about the whole issue about worries about increased suicidality with antidepressants in young people. This is disturbing, but true. This data here is based on a 10-year follow-up study done by Barbara Geller, who is a really big-time pediatric psychiatry researcher. And she took kids, pre-adolescents, and young teenagers who had a major depression and followed them for 10 years. And within 10 years, half of them turned out to have bipolar disorder. And 35% went on to have additional depressive episodes. So what this really says are two things. One is early onset severe depressions are bad news, because you're going to have, it's not likely to be a one-shot kind of thing. You're more likely to have recurrent depressions. But look at that high rate of bipolar. 70% of bipolar disorder in kids starts off as depression, okay? And this makes this very, very difficult, because there are kids out there that have depression. They don't have a hint of mania, okay? And, according to DSM, you have to have a history of depression and mania, then you're bipolar, or depression and hypomania, you're bipolar too. But what if you haven't had the manic part of it yet? Then it makes the diagnosis more problematic. And this is not just an academic issue. These kids get exposed oftentimes to antidepressants, and in the long run make it worse. So I really think that that any child that comes in who has, and I'm talking about pre-adolescents and maybe up to the age of 15 or so, has severe depression, they are bipolar until proven otherwise, because the risks of mistreating them are huge, okay? And when we get to talking about bipolar, I'll talk more about that. Depression in young children, the diagnostic criteria in DSM-4 are not good. Kids have additional behaviors and symptoms that you may not see in adults. I'm going to skip this particular slide and just go here. These are probably some of the things that are going to show up in DSM-5, although it's it's still being drafted. But the second one there is really looking at themes of death, suicide, self-destruction in their play. Especially like drawings that they make, or stuff they talk about, or things they get kind of preoccupied with. I had this like 12-year-old girl, and she just got obsessed with reading obituaries and stuff like that. It turns out, she had really severe depression. In addition to that, are these symptoms here that you do see with with adults. But what's interesting is in pre-adolescent kids, sadness is actually seen in less than half of these kids. Most people think, most parents, most lay people, maybe most pediatricians think depression means you get a depressive affect. You're sad, weepy, and stuff like that. But actually, what's much more common with children and with teenagers is anhedonia and or irritability, and many times the two of them are combined. And the big red flag is disengagement. These kids start just pulling away. They don't spend the night with other kids. They don't invite people over. They hang out in their room a lot more because they have anhedonia. Nothing matters, and you almost invariably get social withdrawal if you have anhedonia. And yet they're oftentimes not a squeaky wheel. An ADHD kid, the whole neighborhood knows this kid has ADHD. But a lot of these depressed kids just kind of, they're not a squeaky wheel, and the parents say, well, they're just going through a phase, or they're just, they're kind of moody or something. But they may, in fact, be in the throes of major depression. And one thing that's really interesting about this is down here, prior to it wasn't until 1975 that the National Institute of Mental Health actually acknowledged that you can have depression in kids. Really? Okay, 1975. But many textbooks for the next, probably 25 years said, yeah, you can have bad depression, but they don't have the vegetative symptoms. But actually they do. In fact, 80% of them have sleep disturbances, okay? And so why did they say they didn't have any vegetative symptoms? It's because the early literature on this, what they did is they asked parents, and the parents would say, no, they sleep okay. And then there was a breakthrough, research breakthrough. Let's ask the kids. And ask these kids, how's your sleep? Well, it's not any good, I wake up like 10 times a night. Or I wake up at 4:30 in the morning and I stare at the wall. Well, do you tell your parents about this? Well, no. The parents assume they're sleeping, you know. So anyway, they do have a lot of these other symptoms as well. But what I really, in DSM-4, they didn't do any field trials on kids or people above the age of 65, and they said here's the criteria for depression, and it's good for all ages, and that's just baloney.